Welcome to the series seminar video tutorials Germanische Heilkunde by Dr. Gerd Hummer, MD. My name is Helmut Pilhar. I am the father of Olivia, and Dr. Hummer's appointed lecturer on Germanische Heilkunde theory. In this seminar video tutorial, the brainstem is discussed. Here we are talking about morsel conflicts. The special programs involved are the gastrointestinal tract, lung alveoli, liver parenchyma, prostate, etc. Germ layer-related programs have germ layer-related brain relays, and thus also have germ layer-related crises. Thus, the crises of these special programs are so-called brainstem crises. One is cold, that's all it is. The cerebellum is discussed. Here it is about the violation of integrity. That is attack, defilement, and disfigurement conflicts. With the cerebellum, however, also the first social behavior was programmed in, the worry or the dispute conflict, concerning the mammary glands. The involved special programs are the dermis, peritoneum, pleura, pericardium, and also the mammary glands. The crises are the cerebellar crises. One is cold and has the typical cerebellar pain in the healing phase. The cerebral medulla is discussed. This is the seat of self-esteem. The special programs involved are bone, jaw, dentin, cartilage, tendons, connective tissue, adipose tissue, musculature. The crises of the cerebral medulla are also inconspicuous. One is cold. Our most complex brain is developmentally the youngest brain, the cerebral cortex. Here it is about separation conflicts and territory area conflicts. The special programs involved are the outer skin, bronchi, larynx, the coronary arteries, the hepatic bile ducts, the urinary tract. The functional failures like diabetes, paralysis. The striking crises are those of the cerebral cortex. One is cold, and in addition one has the absences. The epileptic seizure, the migraine. Here we also find the classic heart attack and pulmonary embolism. You can learn more about this in the approximately 1.5 hour basic seminar video tutorial, Brain Relays, Brain Map. I welcome you to this basic seminar tutorial on Germanische Heilkunde by Dr. Gerd Hummer, MD. The topic of this seminar tutorial is the brain relay, the brain map. My name is Helmut Pilhar. I am the lecturer appointed by Dr. Hummer for the Germanische Heilkunde theory, which is a great honor for me. Initially, I was an engineer. I graduated from the Higher Technical School for Electrical Engineering, and a second time for Mechanical Engineering in Wiener Neustadt. Ultimately, I worked as a software engineer. Since 1990 I have been married to my wife Erika, with whom I have 4 now grown-up children. We have also been grandparents, several times. Due to the cancer of our then 6-year-old daughter Olivia in 1995, we ended up seeing Dr. Hummer and got caught up in a medical conflict that continues to this day. Since 1997, I have been teaching Germanische Heilkunde in close cooperation with Dr. Hummer. Dr. Hummer sadly left us in 2017. But he left us his important legacy. In my opinion, there is no greater and important knowledge than this. The knowledge and correlations of how our bodies and psyche function. What could be more important than knowing how our bodies function? How do diseases arise, and what should I do for them to disappear again? How does materialism benefit me, if I am physically and psychologically ill? Nothing. Right? But it also shows who our friends are, and who is our enemy. And also that we are often our own enemy. With this, Dr. Hummer has made himself immortal. Future generations will be grateful to Dr. Hummer for his discoveries. If we don't let this knowledge be taken away from us. And this has been attempted since the discovery in 1981. The question is whether will we let this happen again, as it has happened many times in the past with other significant discoveries? Brainstem. History of development. The topic of this seminar tutorial is the brain relays. This seminar tutorial ties in with the Brain CT and the Hummer Focus tutorial. I do not train anyone to read Brain CT. I can't read Brain CT myself. But it is not wrong, if you know what is going on in the brain relay. It completes the picture. The Hummer Focus is also the final proof that Dr. Hummer is right. Only the conflict shock is the cause of the diseases that arise of their accord. It has nothing to do with poisoning, contamination, and heredity. Nor do we need statistics. The laws of nature must be reproducible at first glance, or they are just not right. It is similar to the pregnant woman. She must have been with the man, even though she denies it. The whole thing is reproducible to the next best case. So, not with 95% probability was she with a man, but with 100% certainty. Brain cross-section. Let's start with our ancestors, who came from the primordial sea. The creature was a ring-shaped, worm-like creature. It had a primordial mouth, into which it ingested food and regurgitated the excrement through the same opening. The tissue was the glandular tissue. This is drawn in Germanische Heilkunde in yellow. The red tissue was added in the course of developmental history. His brain was only the brain stem. We inherited everything from our ancestors. We inherited his organs, his brain, and also inherited his conflict potential for these special programs. The life content of this ancestor was eating and reproducing. This little animal did not have social behavior at that time. There was also no distinction made here between partner and mother-child. Thus, handedness had no meaning here yet. Instead, one must always think of the worm. The right side tries to take in the good morsel, and along the left side to get rid of the bad morsel. The rupture that ended this ring shape in developmental history occurred approximately at the larynx. What kind of glandular tissue do we have in the head region? There we have the primordial eye with the iris. On the right, there's the light morsel that I don't get. And on the left, there's the image that I don't want to see anymore and that I don't get rid of. Then we have the middle ear. On the right, it's about the information morsel that I want to have, but I'm not getting. And on the left, it's about the information morsel that I'm not getting rid of. Then we have the tonsils and the thyroid. Right, I'm not getting the good morsel. Left, I'm not getting rid of the bad morsel. Then it proceeds to the esophagus. There we have the stomach, it lies on my stomach. There we have the duodenum, which is the annoyance. We also have the pancreas there, the fight for the morsel. The liver. The whole intestine is about anger. Where the small intestine transitions into the large intestine, that's where it transitions from entry to exit. The small intestine absorbs, so it takes the moisture out of the food pulp. The colon has the content about anger, I'm being falsely accused of something. What the conventional doctor calls hemorrhoids, which he also operates on, is in the yellow group. Hemorrhoids are located in the rectum. The colon goes from the bottom right to the top right. Then in the middle of the abdomen over to the left and down again. Now, if I have colon cancer on the right side, it would be located approximately at number 15. In the middle, it would be at 16. If the colon carcinoma is on the left side, it would be at 17. So, the colon cancer, right or left, has nothing to do with handedness. But the whole colon is about that I don't get rid of the annoyance. The same is true of the lungs. We have the pneumonia here, the agony. On the right, I can't get the air morsel in, and on the left, I can't get the air morsel out. So, I can also have suffered a fear of death because I can't breathe. I can suffocate because I cannot breathe in. But I can also suffocate because I cannot breathe out, and I cannot get rid of the air morsel. That we humans have a developmental history behind us, Dr. Hummer demonstrates multiple times. For example, we have arranged the brain relays in the brainstem, precisely to the organs at the organ level. In doing so, however, we must always think of the worm. Notice where the brown arrow points. It points to where the organ is approximately located. Many people have a big problem with the fact that we are supposedly related to the monkey. In reality, it is much, much worse. We are not only related to the monkey. We are even related to the earthworm, to the insects, to the plants, to the microbes. I have no problem with that at all. On the contrary, they are all my brothers and sisters. I have, as it were, an ancestral line going back millions of years. I hope that I will also have a succeeding line, with children and grandchildren and great-great-great-grandchildren. I have no problem with there being common roots somewhere. What's phenomenal for me today as an engineer is that it's alive. That it is alive and that no one can explain it. That is what we, as Germanische Heilkunde boad by. Deciphering how it works, why it's all there. That is actually incredibly exciting. With this knowledge, we can also work casually. Only now, do we really rise above the animal body? Now we can intervene so that we get better. Or so that the partner or the child gets better. High-tech academic medicine can't do that. Those have a massive problem with developmental history. Yes, that's all religion. Let's start with the oral area. That's the underlying oral mucosa. So, what we touch with the tongue is the red squamous epithelium mucosa. Underneath that is the old intestinal mucosa. That's where, of course, the morsel is concerned. In the yellow group, it's always just about the morsel. So for the animal, it's about the real nutritional morsel. It can be the same for us humans. For example, if I can't eat anymore, then the nutritional morsel can be conflicting for me. Or the toddler who gets a bottle of cow's milk instead of his mother's breast. Or not getting what he wants, a cookie for example. Then he may respond with oral thrush. Thrush is the healing. So in the active phase, the yellow group has a cell increase, which makes perfect sense. More mucus, so the morsel slips in or out better. More digestive juices to digest the stuck morsel. So, that's the point. The carcinoma of the palate is the sense to resolve the morsel conflict. Or colon cancer is the sense to resolve the annoyance conflict. So, the symptom helps me to solve the cause. However, one must understand this from the developmental history. Nature associates. If a morsel is too big somewhere and stuck, then a special program starts that helps me solve the problem. You can still understand that a little bit. But nature is associating. For example, the morsel could be the pretty neighbor I would like to snack on, but can't. Or the money or the house I would like to buy, but can't. One just has to learn to understand that. This biological language. How we associate in the moment of shock. That is entirely beyond the conscious mind. The patient has been led astray. He hadn't taken it into account, and he can't really do anything about it. If I cause you a shock and you have a program running now, what can you do about it? It's not your fault. Maybe it's my fault, the one who caused you the shock. But often, it happens unintentionally. For example, if the employer fires the employee because he no longer has worked. The employee is now in a conflict. Who is now to blame? Yes, you have to be a little careful about blaming. It is more important to understand how and why. Why, in our Western civilization, the incidence of the disease is on the rise. Cancer, cardiovascular disease, allergies. That's where we need to start. We need to create a different society, so that we can just stay healthy. If the living environment no longer fits, then the animals disappear. Or one breeds them. It seems to me that somehow we are also being bred. The doctor is present at the artificial insemination and at the abortion. So, it is already controlled in some way. The right side of the mouth and the tongue, for example, also tasting. I don't get to taste something. Then the second relay. This is something totally new, something that Dr. Hummer discovered. It's something like a real brain tumor. However, this is not a division of nerve cells, because there is none. But the fluid is produced in the brain, the cerebrospinal fluid, the liquor. That is glandular tissue. These are, as it were, the cavities in the brain that are filled with cerebrospinal fluid. These cavities are lined with glandular tissue. This is called the choroid plexus. That is really terrible to pronounce. Dr. Hummer said, water center. That fits better, the water center. The conflict involved is very interesting. I want to get into something I can't get into. Something like getting into the clique. I would love to get into the clique, but I can't get in. So, I'd love to get into that business, but I can't get into it. Flowing in somewhere. So one has to really understand that biologically. The sense is more moisture, so that I can slide in better. It's really very, very, very biological. Wouldn't Dr. Hummer have said it, I wouldn't have believed it. I have not believed everything Dr. Hummer has said in all these years. But in the end, he was really right about most things to a large extent. In the healing phase, the tuberculous is breaking down the tumor. Then you have blood in the cerebrospinal fluid, for example. Then the right ear salivary gland and the right lower tongue salivary gland. More mucus to help the morsel slide in. Then we have the thyroid. I was too slow to get the morsel in. In the active phase, a cell increase releases more thyroid hormone, and I really get faster. Yes, I'm in overfunction, and that's the point. I become faster to catch the morsel. When I have the morsel, then the cell division stops. I don't need the function enhancement anymore. Then the trigonum in the bladder. That works the same way as the kidney collecting tubules. The kidney collecting tubes took in water on the right and excreted urea on the left. The trigonum is where the ureters enter and the urethra exits. In this triangle, below the squamous epithelium of the red group is a mucosa of the yellow group, the bladder mucosa. Its function is similar to the renal collecting tubules. I once heard an account of a fakir, who lived supposedly on air and love, that is on light as food. He doesn't eat or drink anything. He was in magnetic resonance, and you could see that his bladder was half full, and suddenly, the bladder became empty. Without peeing. Then it becomes half full again and then empty again. Like the kidney collecting tubes, this trigonum can absorb fluid. I don't understand the conflict content involved at all. It is an incredibly vicious smear. For example, if you have to watch a pregnant woman get beaten up. Then a long round on the right. Note that there is no crossing from the brainstem to the organ level. If I have a long round on the right, then I have a Hummer focus on the right in the brainstem. The junction is only there from the cerebellum. That's where the issue is, I can't get the air in there. Because of a cell increase, more lung cells to optimally absorb every crumb of air. In healing, I then have a tuberculous breakdown, pulmonary tuberculosis. As I said, handedness is not a factor here. Then the right middle ear, the information morsel. I want to get some information that I am not getting. Then the choroid, primordial eye, choroida, the light morsel, the image that I don't get to see. Then the lower is a third part of the esophagus. I have the morsel, but I can't swallow it. I would like to swallow it, but I can't. The esophageal carcinoma in the lower 1/3 part. The stomach. It's on my stomach. An indigestible morsel. Then the annoyance, the whole gut, is an annoyance. The most conflicted environment is one's own family. You have no biological conflict with the Pope. With that, you have a psychological problem, but not a biological conflict. But you do have a conflict with your mother-in-law, wife, son, boss, or neighbor. Then the pancreas, the struggle for the morsel. Who gets the house? The liver, the starvation conflict, I have to starve in a real sense. Then the sober gut or jejunum, the indigestible annoyance with the aspect of starvation. They take the butter off my bread. The ileus or ileum is also the indigestible annoyance with a fear of starvation. Then the kidney collection tubules. Here we are with the dialysis patient with water retention and elevated urea. That's also the gout. That's the refugee or existential conflict. When the animal at low tide can no longer find its way to the saving sea. It threatens to dry out. Now the sensible biological special program begins, drinking every puddle and not peeing. These are constantly drinking, not urinating and storing fluids. However, they can also store urea. The body can recycle protein from the urea. If I am sent into the desert, so to speak, I need water and protein to survive. So, that's very ingenious. When you think about what such an organ can do, it's incredible. I am a software engineer and worked in a machine building company. I wrote the control programs for the machines. That's all incredibly complicated and cumbersome. But compared to the very complex organism, it is child's play. The whole organism is biodegradable and can repair itself. That's amazing. It used to be right in, left out. Nowadays, both kidneys can do anything. Then we move on to the large intestine. The first part of the colon is the appendix. That's the main annoyance. This is the case, for example, when the child has to watch the father beat up the mother. Then 2 or 3 days later they make it up, and then the child has appendicitis. Inflammation is always healing. The whole colon has the conflict content annoyance. I'm being falsely accused of something. The further to the rectum, the more insidious, the more vile this annoyance is. Yes, the vile underhanded shit conflict. This then is the rectal carcinoma. Then we have the primordial eye again. I can't get rid of the image I have there. The middle ear. The information morsel that I have, I can't get rid of it. Then the agony, I can't get the air out. Again the trigonum, similar to the kidney. Then we have another plexus choroideus, I want to flow out. I'm not comfortable where I am. I want to get out of here. Then we have the oral area again, so the ulcers, thrush, tongue cancer, or palate carcinoma. On the left, I'm not getting rid of the morsel. But that could be, for example, it's on the tip of my tongue, I'd love to tell him. But if I tell him, he gets mad at me. I don't get rid of that which I want to say. Then in the middle, we have the uterus and the male equivalent, the prostate. This is a common, semigenital conflict. A typical case then is, that the younger female runs away from the male. So with the older male, who no longer exhibits territorial behavior. If he's still male, that's the typical territory loss in the cerebral cortex with a heart attack or pulmonary embolism. It depends on the handedness. Is he older, or is he soft? Some 50-year-old men are soft. That's most of them. So then he can respond with his prostate, because he can't respond in a male way. Common semigenital can also be, for example, if the son is gay. I would love to have grandchildren, but my son is gay. Also with the woman, it is an ugly and semigenital conflict. The semigenital means that the sexual issue is not the core of the problem but goes along with it. This is also the case, for example, when you belittle the woman. The man undercuts the woman, you slut. On the one hand, she goes to bed with her husband, but it's such a mean argument that she can't have sex with him that way anymore. This is how you can imagine it. But also very, very often it is a loss. A loss conflict for a grandchild, for example. When the grandchild doesn't want to know anything anymore about the grandmother. In the active phase, the endometrium makes the cell increase. That's where the egg settles. That's where women then have a curettage done. That is the older women who no longer have periods. In women who menstruate, it gets shed with menstruation. Then you have clots when you bleed, and heavy bleeding. Records of the brain stem. The brain stem controls the glandular tissue. The conflict content is the morsel, the annoyance. In the active phase, the programs make a cell proliferation. In the healing phase, a tubercular breakdown. The handedness is not relevant here. There is no crossing from the brain to the organ. But always keep the worm in mind. The right side of the brain directs the right side of the organ and vice versa. The biological sense is always in the active phase. The microbes responsible in healing are the fungal bacteria. The crisis is always a crisis of the brainstem. One is cool, or one is cold. Apart from that, it is not very noticeable. So, what is the crisis in aphthous ulcers, thyroid, or pulmonary nodules? One is cold. That is all it is. As far as the gut is concerned, we should really still discuss the midbrain because it controls the smooth muscles. The smooth muscles provide intestinal pressurization. There is then a strengthening of the smooth musculature by a cell increase in the active phase. But this remains even after the conflict resolution. It is not broken down. In the active phase I have constipation. In healing diarrhea, and in the crisis constipation again. Of course, then I am also cold. I would then possibly have paralytic ileus in the crisis, intestinal paralysis. But otherwise, the crises of the brainstem are not so noticeable. Cerebellum. History of development. The little animal has then conquered the land. Now it needs extra organs to protect itself from the sharp stones. Brain section. Additional now are the internal membranes, the peritoneum, the pleura, the pericardium, and the dermis. And an additional control, the cerebellum. With these diagrams we always stand behind the patient and look at him from above. At the very bottom of the cerebellum is the dermis. So in the body, it's at the back of the cerebellum. The program of the dermis is melanoma, the skin cancer. And that's also the acne, which is healing. It's skin tuberculosis. The foot fungus is hanging healing. So when a stage of healing doesn't go away. Of course it's called hanging healing. Then there is a track. That's the shingles, which is also the healing. That is the plague, and then in the hanging healing, I have leprosy. So, plague and leprosy are the same things. Plague is conflict active, and leprosy is the hanging healing of that. The mammary glands are converted sweat glands. That's why we find breast cancer in the dermis, so in the brain relay for the dermis. So, the type of tissue of mammary carcinoma is not really different from melanoma. It's the same tissue. From now on, handedness is decisive, partner or mother-child. Left or right-handedness, this is where the first social behavior was programmed. The care conflict. More breast milk to give the sick partner or child a higher chance of survival. When he gets better, the cell division stops, and in healing the morsel is cleared. So, the sense here is again in the active phase and function through a cell increase. The same in melanoma, the sense is to resolve the attack, the deformity, the defilement. To protect myself, to protect my integrity. So, this is about the violation of my integrity. Attack conflicts, mutilations, defilement. If I'm spit on or if I have an ugly scar after surgery, if I'm disfigured or if I'm slapped. That also happens verbally. When people say rude things to my face, I react with acne on my face. When people talk badly about me behind my back, I have acne on my back. Of course, only if I notice it. If I don't notice it, then I have no conflict. What I don't know won't hurt me. So, I would need to know that people are talking bad about me. Then in the middle, I have the pericardium. The pericardium is an attack against the heart. The pleura and the peritoneum used to be one. Only during development was this divided up. So, the attack against the chest or the abdomen, the mesothelioma. That's the active phase. A flat growing tumor, the mesothelioma, makes the wall to the outside thicker to protect me. That's the biological sense. In the healing, it gets broken down by tuberculosis. At the end of healing, the symptom is gone. So, nature has given us the programs. Just think, this is all in the fertilized egg, the blueprint. For the eye and for the heart. It has also programmed the special programs that are called up when needed. Indeed, that is brilliant. The problem is not the symptom, the melanoma, but the problem is the cause, the defilement. If I resolve the defilement, then the melanoma stops. Then I don't need the melanoma anymore, because the cause is solved. Nature has also given us the microbes. The surgeon's now clearing the melanoma because I don't need it anymore. So, the melanoma is the therapy for the cause. Now that the cause is resolved, I don't need the symptom anymore, and then I need the microbes. All of that costs nothing. And it has no side effects. So if someone spontaneously becomes healthy, what side effects do they have? None at all. That is the medicine of freedom. Between me and my health, there is neither a doctor nor medicine. On the contrary, the doctor's stupid comment, "Oh, that's a melanoma." Then I feel even more attacked, and the melanoma gets even bigger. We have to cut that out far into the healthy tissue, otherwise there will be metastases. Or, is that a metastasis? You then have a pimple somewhere, and bam, you overreact. That ends in disaster. Only because of the scaremongering. That's the interesting thing. It's all in the head. Conventional medicine trades on fear. It is nothing but that. Just like the church with the devil, that is also trading with fear. We are so super religious that we allow ourselves to be frightened. We have to pay a small fee to go to heaven, to get rid of debt. So we have to pay the prescription and swallow bitter pills to get better. It's all just hot air. Records of the cerebellum, this is the glandular tissue, the old mesoderm. The conflict content is the disfigurement, the violation of integrity, respectively the care dispute conflict in the mammary glands. In the active phase, the programs make a cell proliferation. In the healing phase, the tissues are degraded by tuberculosis. The handedness is decisive. From now on, the brain-organ-nerve connection is crossed. By the way, one gets a few experiences in passing. A participant in a seminar told me that she had breast cancer on the left side, which she had cut out. Then she had a brain tumor in the cerebellum on the right side. She had that one excised as well. Then, of course, the Germanic healer knew immediately that the breast on the left was healing and that she had edema in the cerebellum on the right. They caught her in the healing phase, so to speak, and she let them do everything to her. It's insane. But the amazing thing is, how it all fits together. So, the left hemisphere of the brain controls the right organ side. The sense is in the active phase by a cell increase, a function increase. In the healing phase, we have fungal bacteria, also called mycobacteria. That is something between a fungus and a bacterium. In a crisis, one is cold. The shingles hurt in healing, the breast cancer also hurts in healing. This is what Dr. Hummer calls a typical pain of the cerebellum. Cerebral medulla. Developmental history. Then the little animal needed a locomotor system, brain section, and that required an additional brain, the cerebral medulla. Here we are talking about the connective tissue. That's where we have the seat of self-esteem. A person with healthy self-esteem walks upright. A person who has a violation of their self-esteem has problems with their musculoskeletal system. The brain relays are arranged in the same way as the organs at the organ level. The content is a violation of self-esteem. In this, the severe self-esteem violation will affect the bone. A slighter one affects the lymph node belonging to the bone. The still slighter one affects the cartilage. The still slighter one affects the connective tissue, and the lightest on the fatty tissue. Each bone and joint has its own self-value content. For example, the skull has the intellectual violation of self-esteem, how could I have been so stupid? In doing so, one can then hit oneself on the forehead. Then the jawbone, the tooth bone, not being able to bite. The opponent is too powerful. What do I do with the teeth? Bite. Thus, each organ has a job to do. Why do I have an organ? It must have a task, a meaning. What do I do with my teeth? Bite. And if I can't bite, then the jaw osteolysis. Notice, now we are in the cerebrum or new brain. The brain stem and cerebellum are called the old brain. These programs make the cell increase in the active phase. We call the cerebral medulla and the cerebral cortex the new, or big brain. These programs have a cell decrease in the active phase. Thus, the connective tissue necrotizes. In the case of the bones, this is called osteolysis or osteoporosis. Descaling or holes in the bone. That's also the periodontosis in the active phase, and then my teeth fall out. Then we say, I'll bite my teeth on that. The handedness is decisive. Each tooth even has its own biting content. So, the incisors, unable to bite, unable to fend off. Then the canines, the catching teeth, unable to hold on. The molars, unable to grind. The same is true of the jaw. So, osteolysis at the front of the jawbone means not being able to repel, or not being able to bite. And more to the rear, not being able to grind. The issue is not so much whether it is the upper or the lower, but whether it is the incisor, the canine, or the molar. Then the cervical spine. That is the injustice of the world, the humiliation. The stiff neck again is the healing. So, the active phase does not hurt at the bone. That's the foolish thing about it. You build up conflict load without pain. At some point the bone breaks, or the tooth falls out. But you have no pain. However, you notice the healing immediately. Possibly at the same time or a minute or an hour later. What hurts at the bone is the periosteum, the bone membrane. That's like a tough shrink tubing. That hurts because of the stretching. Using bacteria, the jaw is repaired or the bone recalcified. The holes are filled in again. Then you go to the dentist, and he looks into the pockets and he sees the bacteria at work. He thinks that those caused it. That we wouldn't brush our teeth properly, because there are so many bacteria. That's all nonsense squared away. It doesn't matter if I brush my teeth or not. If I am not running a program, then I have nothing to do with the bacteria. But if I am in healing, then the bacteria are working whether I brush my teeth or not. Finally, it's just creating commerce. I also brush my teeth for the well-being of my loved ones. So out of genuine charity, so that the person doesn't get knocked out in the morning. But brushing your teeth does not protect you from tooth decay. The shoulder means, I am a bad partner to my partner, usually of the same generation. For the mother-child shoulder, I am a bad child to my mother, older generation. Or a bad parent to my child, younger generation. Why does mother-child actually belong together? That's from the cerebellum onward. The earlier man was female. The remnants of that can still be seen in the man today. He has nipples. Have you ever thought about why a man needs nipples? Because it looks pretty or what? To play with them or something? Or for piercings, which is why nature will have given us men nipples. This, of course, originates from developmental history. The early man was female. In nature, the relationship of mother-child is always clear. The mother knows from 100 children that the one is hers. The child knows from 100 women, the one behind that is my mother. So, that is an unambiguous relationship. All others are partners. It doesn't matter, the father is a partner, the siblings are partners, the opponent is a partner, friends are partners, mother-in-law is a partner. The mother is the older generation, the child is the younger generation. The partner is usually from the same generation. The active phase doesn't hurt, and I can't get my arm up in the healing. So, as long as I was conflict active, as long as I will have pain. Until the crisis. Then the pain is gone again. As long as I was conflict active, determines how long I will be in healing. The crisis is another one of the cerebral medulla that means I am cold most of the time. Now, it doesn't matter if it's the lymph node or the bone. One is cold, that's all it is. The spine carries our person, the center regarding my person, I have been deceived, or I have failed. That goes on the sacrum. Toward the pelvis, it's a sexual violation of self. That's so typical of sciatica, that's a violation of self-esteem in bed. The pelvis represents the baby. If the woman does not want a child from the man, he may respond with osteolysis in the pelvis. Pubic bone, in bed, I am worth nothing. The sexual violation of self-esteem. In men, this is usually the result of impotence due to prostate removal. These are typical follow-up conflicts. Then he has osteolysis in the pubic bone. Then the doctors say that the prostate cancer cell, the itchy crawling cell from the prostate, that is glandular tissue, that has migrated to the bone and has now spread there. The prostate tissue gets bigger and bigger in the active phase. And what do the metastases in the bone do? They make holes. How is that supposed to work? How can a glandular cancer cell suddenly become a hole in connective tissue? So, it's all so. I mean that people swallow all this without questioning it. I don't understand that at all. Then they get slaughtered with poison gas to fight these never-before-seen crawling cells. Hardly anyone survives. Everyone knows that virtually no one survives. The survival rate is a few %. So, the chances of the patient not surviving are very high. He knows that. He's completely panicked, but hanging on to the oncologist's leash. They shamelessly abuse that. They strangle him for the next chemo. And then they say, "Oh well, we don't have anything better." It's interesting, though. One should study the stupid human race. Then the elbow, the inability to hit. The fingers, the clumsiness of me. The typist is not hitting the keys correctly. I am not being able to hold it. The wrist is a situation not under control. The tendon knot is the hanging healing. So at the end of the healing, the bone is denser and thicker than before. So that it doesn't happen so quickly anymore. One can remember that with the bone fracture. At the end of the healing, the bone fracture is thicker, denser than before so that it doesn't happen so quickly anymore. In the same way, the biological sense here is only at the end of the healing, but for a lifetime of permanent function enhancement. That is as it were the therapy here in the deluxe group. The hip, I can't get through. The thigh, I can't get through something. The handedness is decisive with partner or mother-child. The knee, sportsmanship. Again, it always depends on what my self-esteem is based on. For example, if I miss the ball by 3 meters from the goal, then I may have a sportsmanship self-devaluation conflict with my teammates. Then I attack the knee of my teammates. But if I'm actually playing soccer to impress my mom, who likes to watch me and then tells me, "You did good," then, when I hit the ball off, it's a violation of my sports self-esteem toward my mother. Then I react with the mother-child knee. So, it's about what is going through my mind at that moment. What has meaning for me at that moment? The other one doesn't care if the mother is watching or not. But not for me, because I'm a mama's boy. For me, mom is an important person. Of course, that doesn't make it any easier, because there is no pattern. But on the other hand, people's conflicts and solutions are as individual as they are. That's just the way life is. Nevertheless, everything somehow follows the 5 laws of nature, these rules and laws. What one sees as a conflict, another laughs at. That's just the way it is. Then the foot. Not being able to dance. Not being able to walk. Not being able to kick. Not being able to balance. I would like to kick the boss's ass, but I can't, because he is the boss. The tendons still have some of the movement in them, as do the muscles. The tendons attach to the bones and can necrotize in the same way. At the end of the healing, they are thicker than before. If I get into hanging healing, they can ossify or calcify there. Then I have the calcified shoulder or the heel spur. Added to that is the aspect of movement, like with the muscles. With the muscles, I have a motor conflict. My inability to hold on, not being able to defend myself. Depending on what I do with a particular muscle. The muscles are also connective tissue. As a result of not being able to hold on, I have paralysis, and as a result, I have muscle atrophy. To resolve muscle atrophy, I must first resolve the motor conflict. Then the bacteria refill the muscle tissue. At the end of healing, it is more robust than before. It is the same with the bones. The tendons also move in the direction of movement, as do the muscles. In the same way, the cartilage, which is also a violation of self-esteem. In the active phase, I have osteoarthritis, and in the hanging healing, I have arthritis. Then with the syndrome, I have gout. The lymph node also has the same content. So, the shoulder, I am a bad partner, or I am a bad child or a bad parent. In the active phase, the lymph node necrotizes. That is not noticeable. If you were to cut it, it looks like an Emmental cheese. In the healing phase, it does stand out. It recovers under swelling, and in conventional medicine, that's when I have lymph node cancer, Hodgkin's disease. The swelling decreases at the end of the healing phase, and the lymph node remains palpably enlarged. It can be as big as hazelnut or walnut. But I will have a palpable lymph node for the rest of my life. A thicker lymph node is better than a thinner one. It doesn't matter for the rest. The other has a crooked nose on his face. That doesn't matter either. One can make a mountain out of a molehill. Conversely, for example, jaw osteolysis is ignored in conventional medicine. Whereas with us all the alarm bells are ringing, because it is still conflict active. Your teeth will eventually fall out. The healing is the evil in conventional medicine, a bone cancer. Which we then rejoice in. Fortunately, I have resolved the conflict, because I have to resolve the conflict. If I don't resolve it, my bone will break. I'd rather solve it today than tomorrow, because tomorrow I have more conflict load. With bones, we always have to deal with the blood count. In the active phase, anemia. The number of white and red blood cells drops. But also the platelets. And in the healing phase, all this is produced again in excess. Then I have leukemia. So, we always talk about the luck of leukemia. Fortunately, I was able to resolve the violation of my self-esteem, and sooner rather than later. Tomorrow I will have more conflict load. Hence, the happiness of leukemia. Leukemia and anemia, that's tandem. They belong together, like pulmonary rounds and pulmonary tuberculosis. In conventional medicine, they are two different things. They haven't wanted to understand that, either. But you see that with the Chernobyl kids. They have leukemia. And why? Because radioactively destroyed the bone marrow. In the patient who is exposed to radioactive radiation, his blood is immediately destroyed. If you stop the radiation, then the bone marrow tries to repair itself with leukemia. In the Germanic, that would be more similar to poisoning. So if I expose myself to radiation, I don't have to resolve a conflict. But the healing goes the same way as with the special programs. Also, with the poisoning from the chemo. Because of chemo, the patient has no blood. That is a religious ritual. The chemo is the slaughter, and nothing else. No matter which patient, no matter how old, they all get chemo. And what do all chemo patients have in common? No blood. For themselves, the oncologists reject it, but to us, they shove it down our throats. If you stop chemo, you might react with leukemia. That's in any instruction sheet, that you will then react with leukemia. In conventional medicine, leukemia is a separate cancer. That means that the conventional doctor gives chemo for cancer and believes that the chemo itself causes cancer. So, you have to understand that well. You really have to be a conventional doctor to understand it well. This logic. I don't see any logic in conventional medicine. Then we have the testicle, the ovary, and the renal parenchyma. The glomerulus, the testicle and ovary, that's the loss by death or departure. This always involves a living being, an animal, or a human being. I cannot suffer a loss conflict for the laptop or for the car. In the active phase, the tissue necrotizes, and the testosterone or estrogen levels drop. This also leads to infertility if both testicles or both ovaries are involved. In healing, the testicular cyst or the ovarian cyst develops. We are talking about healing cysts, which therefore develop during healing, and these are permanent. Microbes do not break them down, because the cyst itself is the sense. At the end of healing, this initially liquid cyst is solid and produces massive amounts of testosterone or estrogen. The man becomes more masculine, and the woman becomes more feminine. The man looks younger, and the woman looks younger. But then right away, 10 to 15 years. They have a high libido. So, Viagra is not needed by this man with a testicular cyst. He saves himself a lot of money. Under the circumstances, the woman enters menopause much later, not until she is 60 or so. To make up for the loss again with another conception or pregnancy. That's the program of the Deluxe Group. In conventional medicine, one sees the dividing cell. The ovarian cyst or testicular cyst has a high cell division rate. This is seen as terribly malignant and one castrates the poor patient. The renal cyst. The conflict is called a fluid conflict, an overload of fluid. Of course, only the land creature can suffer this. The fish in the water will not have the conflict, help, I am drowning. But the land creature with too much fluid. Typically the near drowning or a flood or something. Now the parenchyma is necrotizing. Parenchyma means organ-specific tissue. The liver parenchyma is the yellow group, the round focus in the liver. Or the lung parenchyma, the round nodule in the lungs. And in the case of the kidney, it's the renal parenchyma. Then in the active phase, I have less filter tissue. Now, less goes through the kidney filter. Therefore, the pressure is increased, and the patient has high blood pressure in the active phase. So, this is the continuous high blood pressure. Both values continuously increase to allow the urinary substances to be excreted. Although there is less tissue, by increasing the pressure, I still get the required amount through. With the resolution of the conflict, the necrosis stops. Then a cyst grows out of the kidney. In conventional medicine, this is called a Wilms tumor. They see these as incredibly malignant, because of cell division. That's what my daughter Olivia had. The blood pressure normalizes immediately, At the end of healing, this renal cyst is fixed and produces more urine. Now the individual can better handle more fluid, the deluxe group. But of course there are kidney cysts, ovarian cysts, and testicular cysts that grow to be of considerable weight. Of course, one will not plague themselves with a 35-pound ovarian cyst for the rest of their life. That is where we too would operate. Cut the strand at the ovary and remove the tumor. It's compact, doesn't stick anywhere, hasn't grown anywhere. The ovary stays in and the patient is around 35 pounds lighter. Statements of the cerebral medulla. The cerebral medulla controls the connective tissue. The conflict content is the violation of self-esteem. In the active phase, there is a cellular decrease. In the healing phase, it is refilled. The handedness is decisive. From brain to organ is crossed. The biological sense here is at the end of the healing. Normally, the sense is always in the active phase, but in these programs it is only at the end of the healing. That is why Dr. Hummer also speaks of the deluxe group. So, here nature does not help immediately, but at the end of the healing. But then for a lifetime. The bone remains stronger, or the ovarian cyst permanently produces more estrogen. The associated microbes are the bacteria and the crisis is usually cold. The crises so far have been fairly unremarkable and unspectacular. Such a crisis can be a second peak or last for several days. The patient is just cold. The cerebral cortex. History of development. The most complex part is our youngest brain, the cerebral cortex. It controls the squamous epithelium and function failures. There are two major themes, separation and territory. Then we have these cortical centers. SB means sensory area leg. So, there we have the outer skin with neurodermatitis, psoriasis, hair loss, cold eczema, hives, urticaria in medical terms, basal cell carcinoma, warts, and so on. That's just the outer skin. That is always a separation. The organ inside means I don't want to be separated. Organ outside, the back means I want to be separated. Hair is still inside, I do not want to be separated. So, baldness is the active phase of a separation conflict. You always have to look for the conflicts where they started. Where the symptoms started. Here on the right, we have the bronchial mucosa. Here we have bronchitis or bronchial carcinoma in the healing process. On the left, the laryngeal mucosa in the healing process, we have hoarseness or laryngeal carcinoma. The squamous epithelium is repaired under the swelling. These stages of healing are all considered cancer in conventional medicine. MB stands for motor area leg. Paralysis. We are in the active phase of MS, and in the crisis of epileptic seizure. In the upcoming healing, we have Parkinson's. So MS, epilepsy and Parkinson's are always a motor conflict. The stroke, the tremor, or Huntington's disease. That's always motor area via tracts. So that's the shock and the rest is an allergic reaction. The tract is an early warning system. Attention, something bad has happened. Then the SBS, the special program starts again, without again meeting the 3 criteria. Very acute, isolating and caught on the wrong foot. One reacts allergically. But we have the bronchial muscles here on the right, in the crisis spastic bronchitis or bronchial asthma. Those don't get the air out. On the left, we have the larynx muscles, pseudocroup, or laryngeal asthma, they don't get the air out. In those who stutter, there is also an impact in this relay, the Brocaid center is also on the left. Then PB, post-sensory area leg. That's where we are at the periosteum, the bone membrane. This is rheumatism, the flowing pain. If one were to associate the violent separation to the feet, one has the feeling that the feet are stuck in a block of ice. It is like going from ice cold to hot in the healing phase, as in the winter, toes. The periosteal pain during the healing phase is relentless. Post-sensory also includes the coronary vessels and so on. Post-sensory, that is after the sensory. Then before the motor cortex, there is also a promotor sensory cortex center. That's what Dr. Hummer calls it. Then the visual cortex, the retina and the glass body. That's where the fear in the neck, the attack from behind comes in. With the retina we have nearsightedness, farsightedness, retinal detachment, and macular degeneration. I have a black dot wherever I look. With the vitreous body we have the green cataract, with a loss of visual field in the active phase. In the healing phase we have glaucoma, the increased eye pressure. The vitreous body is the fear in the neck of the predator. The retina is the fear in the neck of a thing. So, the glass body is personified, and the retina is a thing or situation. For example, as a student, I can be afraid of the homework chasing me, so I have the retina involved. But as a student, I can also be afraid of a teacher because he has the hots for me. Then I have the glass body involved. Cerebral cortex center seen from the side, the motor is blue and the sensory is red. It has worked its way between them like a wedge. Where they come together, that's where the cardiac relays are. And that's where the action is. In conventional medicine, the control of the heart is entirely unknown. So, the way it works. For example, a heart attack. The word is already wrong. Infarct means occlusion. The coronary vessel of the heart does get repaired under swelling during the healing process, it is true. But that does not cause cardiac arrest. The cardiac arrest here comes from the heart center in the brain. There are no more signals coming to the heart. So, a heart failure has nothing to do with the occluded coronary vessel. That's just an accompanying symptom. Heart failure is purely a brain symptom. All these bypass surgeries are lucrative businesses but not causative therapy. For example, he has already had 5 bypasses and is still dying of a heart attack. It has nothing to do with that. The heart is totally misunderstood by conventional medicine and totally unknown to them in the brain. Then here's a cross-section of the brain. There we have the ventricles, these cavities with cerebrospinal fluid. We have there these cardiac relays, these bulges in the cortex. The right one controls the coronary arteries, the left one the coronary veins. On the right side, we have a heart attack. On the left side, we have a pulmonary embolism, as the crisis. Now the crises are very noticeable. In the blue motor cortex, now in crisis, we have the epileptic seizure. In the red sensory and post-sensory cortex, we have the absent thinking. The patient does not respond when addressed. So at the complete sensory center, in the crisis there is the absence. In the motor cortex, we have the loss of function. Here in the crisis we have epileptic seizures. So, also the heart attack is what we have in the crisis. Pulmonary embolism is the crisis of the coronary cardiac veins. In this, we also have the absent thinking. In the center we have the bridge that holds the brain together. You may have seen this before. Half a human being is drawn across the brain like this. Now if you look, just how motorically steered the lips are. I need more brain than to steer the knee. Also, to steer the hip I don't need that much brain. You can see this in the sensory overview as well. I need much more brain for the lips than for the knee. Motorly, the signals from the brain go to the lip. One can do a lot with the lips. You can move them in all kinds of directions, while the knee only makes one movement. I don't need that much brain for that. The sensory signals go from the organ level to the brain. So, when I am touched, the skin registers it and reports to the brain, hey, you've been touched. So, the signal goes from the organ to the brain. With the lips, we are very, very sensitive. If an ant runs across the lip, we notice it immediately. But on the knee, you don't notice it immediately if something scribbles. If you were to draw it to scale, this homunculus would emerge. So, we also have a high level of fine motor skills for the fingers and hands, a high level of sensitivity, but not so much for the elbow. The same is true for the feet, they are also very sensitive, and the knee is not so much. That's drawn to scale. The homunculus was already known in conventional medicine. One knows that if we cut out the motor part in someone on the right, then he is paralyzed on the left. We know that. But Dr. Hummer was able to pinpoint it much more precisely with the Hummer's focus. The motor cortex of the brain. This is the cross-section of the cerebral motor cortex. The brain, of course, we must be able to read 3-dimensionally. For example, if my partner runs away from me. I can't hold the partner, and I am right-handed. Now the right partner arm is paralyzed, and then I have the Hummer focus in the left motor cortex in the center of the arm. Left for the right arm. Sensory cortex of the brain, but I can also respond sensorially at the same time. What is the shocking moment about for me? Is it about holding me, or is it about hugging me? If it is about hugging for me with touching, then I also involve the right arm. So, the Hummer focus in the motor cortex and one in the sensory cortex. MS is typically a sensory paralysis and motor paralysis. The Hummer focus involves sensory and motor paralysis. In the active phase here, with the outer skin, we have numbness, the sensory paralysis. That's how MS is usually diagnosed, because of the numbness. Post-sensory cerebral cortex. However, I can also suffer a brutal separation. Then again, if it involves the right arm in there, I have the Hummer focus again, but now I am reacting with the periosteum. As I said, there you have to imagine the homunculus. Then it goes down between the hemispheres. Then there is the leg, and there we have the foot at the very bottom. Territory relay. The most complex part of the cortex is the so-called territory area. These areas are marked with a thin dotted line. We have the male on the right and the female on the left. That has to do with the hormones. But it's the same for men and women. Female on the left and male on the right. The male has his outdoor territory. He goes hunting. The woman has her inner territory, her nest. She raises the children. The man is a hunter, and the woman is a collector. Just think of the woman's handbag. That is also one of the remnants of developmental history. The male principle is that the man goes on the attack. The female principle is that the woman goes on the defense. You can observe this beautifully in road traffic. One perception is the counterpart of the other. The territory also includes the sugar relays. Here we have the alpha and the beta islet cells. Alpha makes glucagon, beta makes insulin. That's where we are at the function faller. There is no cell increase or cell decrease. If the Hummer focus is on the left, I'm undersugared. If it's on the right, I'm oversugared, diabetic. The feminine is fear disgust, the spider. Fear and disgust at the same time. The male perception is self-defense. Then the territory fear. The rival is about to break into my territory. The female perception is scare fright. Oops, the thief and blanket over the head. Then the territory loss. The rival comes and drives me out of my territory. What the territory is to the male, the baby is to the female. That is the sexual frustration conflict. When the man doesn't want to have a child from the woman. Then the territorial anger. The rival is in my territory, he has invaded my territory. Or if the woman is cheating, if the content is cheating. The female counterpart is the identity conflict. Where do I belong? Where should I go, or what should I do next? How do I decide? And the territory marking conflict. There we have the urinary tract. Renal pelvis, ureters, bladder, urethra. Right relay for the left organ side, and left for the right. The male has the outer territory. That usually involves boundary disputes with the neighbor. The woman has inner territory. Where do I belong? Do I belong to that man or to that man? If she knows, then she has a bladder infection. This is where handedness comes into play, but not partner and mother-child side. Let's say the male has a fear of territory. If he is right-handed, it strikes in the bronchi. In the mucous membrane or in the muscles, usually both. If he clears that, then he has bronchitis. If the man is left-handed, then he has what is known as the night hop. In the left-hander, it strikes in the larynx. If a left-hander resolves the conflict, then he is hoarse. So, handedness plays a role, but not partner or mother-child. This relay of the bronchial mucosa controls the entire bronchial mucosa, right and left. And the relay on the left controls the whole larynx, right and left. It has nothing to do with a partner or mother-child. Handiness plays a role, but so does the hormone level. So, when the thief comes through the window, the male reacts with territory fear, the female reacts with scare fright. So, she hides under the bed, she goes on the defensive. If she is right-handed, she has her impact in the larynx. If the man chases the intruder away, she resolves the conflict. She is then hoarse. The Hummer focus hits the bronchi with the night hop in the opposite relay, if she is left-handed. If the man chases away the intruder, the left-handed woman has bronchitis. So, the handedness is decisive, the hormone level is decisive in these territorial areas. But not the partner or mother-child side. Partner and mother-child has nothing to do here. If I suffer a motor conflict, if for example I cannot hold the partner as a right-hander, then I have Hummer focus on the left in the motor cortex. If I can't hold the mother or child, then I have the left arm affected as a right-hander, and I have the Hummer focus on the right side. When it comes to territory, the partner or mother-child has nothing to do there. The handedness and the hormones do, but the partner or mother-child side does not. The handedness can never change. I am right-handed. The handedness is determined at the first cell division of the fertilized egg. Think of identical twins. There is always a right-handed one and a left-handed one. Handedness is determined only from the cerebellum onwards. That means that at the first cell division, the cerebellum has already developed. And it always remains so. I will never become a biological left-hander. But I do become feminine through the hormonal change, that's okay. Now, when the thief comes through my window, I send grandmother, my wife ahead and I hide under the bed. I am right-handed now, and I remain right-handed. Now I have my scare-fright conflict in the larynx. As a hormonal male, I would go on the attack, and it would affect me in the bronchi. Female, I go on the defensive and have it in the larynx. It's a little bit complicated. In the territorial area, conflicts can also jump when the hormone levels change. So far, for example, I have always had the intruder in the bronchial relay. Now, as a grandfather, the conflict jumps to the laryngeal relay. So conflicts can jump back and forth there in the territory, as the hormone level changes. This is the most complex part. Psychoses are also another complex topic. For example, when a right-handed person suffers a territory loss, he has the Hummer focus on the right. A characteristic of these territories is that the first conflict closes this half of the territory. So, the right-handed person's male perception is taken away. The left female side is still free. With the one conflict, he is feminine, a softie. He has changed his character. The second conflict must always strike the opposite relay and is then experienced as such. So now, if the softie has a female perception and the burglar comes through the window, he goes on the defensive with a female scare-fright. He then has it as a second conflict in his larynx. So, a female scare-fright for the right-hander. With the impact of the second conflict, a scale is created. Now the issue is which conflict has more weight. For example, if the left conflict has more weight, the scale falls on the left and the feminine side is more blocked. Therefore the male side is more open. Then one is manic and masculine. If the right conflict has more weight than the left, then the male side is more blocked. And the female side is more open, and then one is depressed and feminine. In adults, it is called burnout or manic depression. At the same time the building up of the conflict load stops, cancer stops. At the organ level you are seemingly healthy, but psychologically you are conspicuous. It also stops emotional development, the maturity. So with the onset of the second conflict, the emotional maturity stops. One also looks younger, the baby face. The body shape also changes. If it is early in childhood, it is seen in the right-handed man, whose right male side was closed. The earlier he became female, the rounder his shoulders are, and he has changed in character, he is basically homosexual. We also have the fixation here. For example, if the older brother is programming because he beat him up, he is now fixated on the brother. If his mother ran away from him, then he is fixated on his mother. If the alpha is programmed, then he is fixated on the alpha. The fixation. And everything they say is the amen in prayer. You can't approach those with logic anymore. That's the way it is, that's the fixation. In the same way, it goes with the girls. When the first territory conflict has to do with the father, then the child is fixated on the father. That's how nature builds the natural ranking, the pack. The pack needs one alpha. That one has no conflicts in the territory area. That's where the alpha differs from all the others who are beta wolves. They are fixated on the alpha. What the alpha says happens. That's how the business works. It needs a boss, and the others have to fall in line. Then it works. Nature does that through conflict. So, here with these territorial conflicts, it's all about rank and reproduction. With the softie with his conflict, the libido is minimal. He has no desire. The alpha has a highly pronounced libido. When the female has her ovulation, the alpha is ready. Then she is pregnant for 9 months, and then she breastfeeds for 2 to 3 years. During this period, she is male. The fully breastfeeding mother does not have ovulation, just like the pregnant woman. With the phasing out of breastfeeding, she has ovulation again. So, the female in nature has an increased libido every 3 to 4 years, then the alpha is again at her disposal. The beta wolf has no desire at all. Thus, the female always has the best for her children. But that's what every farmer does. If he wants calves, he gets himself a strong bull. But today, in our society, every male has his female. This is not really in accordance with our biology and is not really ideal. But here we are talking about the realization of the order of rank. We can recognize in the wolves the alpha, in the deer the point deer. We can recognize in the gorilla the grayback, the alpha. But so can the other animals. Each of them can recognize the alpha. But how a homosexual can become a foreign minister today? You need other information for that. Imagine a pack of wolves with a homosexual foreign minister. Biologically, that's a laugh. That's precisely the kind of nonsense they're pushing on us. Or show me one company that is democratically run. It doesn't work. Every company is run hierarchically. The state is suddenly supposed to be run democratically. That can't work. Democracy is the dictatorship of the lodge. In reality, these so-called representatives of the people are all hierarchically subordinate to their lodge master. They all serve one again, their lodge master. And at the top are those who really rule the world. Those who create money out of nothing. Vatican City and the City of London and Washington, D.C., they run the world. They have undermined the sovereign states and turned them into corporations. Now there is privatized law. Now corporations dictate the laws to us. Without sovereigns and without any legitimacy from the people. This was the coup, a global coup. The New World Order. None of this would be possible in nature. If a gay man said he wanted to be Secretary of State, everyone would be doubled over with laughter. We need a biological society again. The Germanic somehow shows us the way there. As I said, that is understood and respected by everyone who thinks biologically. But if a gay man comes in, and you don't know he's the foreign minister, that's just a gay man. But if an alpha comes in, you don't know who he is. But you immediately respect his personality, his charisma. An alpha is usually respected and appreciated, and people seek his advice. He is loved. That is not a tyrant. Only in the constellation do we have this conspicuous behavior. If the scales are balanced, then you are inconspicuous. If these are off, then you are conspicuous. And the supersense of the constellation is, that one is put on ice. It stops the maturity, the conflict load, and the cancer. We are actually waiting for better times. One is more or less the spare wheel of the group. One is frozen in. One himself fails to resolve the situation. One must wait until the situation turns in one's favor. Then one can resolve the constellation. Then one can catch up with the emotional maturation and even become alpha, but otherwise, the purpose of this constellation is to serve as a kind of spare wheel. Nature does not do anything senseless. Dr. Hummer said, that what we thought until now is backward. That it is just the transcendence. So, there are different constellations. For example, the mythomaniac, he talks everyone down until they flee. That's what the supersense is in this. The choleric just kicks himself free at that point. That's then what the supersense is here. But in general, one can say that it is the sense of being put on ice. There are no alphas in our society anymore. We are mostly all constellated in childhood, primarily through this early sexualization. We are dealing with a generation of people with emotional developmental delays. They are, of course, very easy to satisfy materially, and very easy to lead and control. Just like the herd, trained. Horrible. Madness. From that point of view, we are living in a very dark time. But in general, we always have a cellular decrease in the squamous epithelium in the active phase. For example, when I have a fear of territory, the bronchial mucosa ulcerated and I get more air in my lungs. This makes it easier to resolve the conflict. When I have a loss of territory, the coronary vessel of the heart ulcerates, the squamous epithelium melts away. The lumen increases, and I get more blood to the heart muscle. I get nitro injected into the carburetor, so to speak. I get a more powerful heart. Or with a territory marking, not being able to determine the territorial boundaries. The urinary tract ulcerated and I get more urine out of it at the same time, to better define the territory. In other words, through a cell decrease, a function increase. In the old brain group, there is a functional strengthening by a cell increase in the active phase. Here in the red group, there is a functional enhancement by a cellular decrease in the active phase. In these two groups, nature helps directly in the active phase. In healing, the event is repaired under swelling. But without microbes. In the past, it was thought that the virus was responsible for this. For example, the fever blister, the cervix uterine cancer, the liver and bile ducts with jaundice. But the virus does not exist. That has never been seen, never been isolated. Don't be seduced by those pretty graphic pictures of viruses that people show you. At the end of the healing, the swelling goes back down, and the bronchi are open again. The urinary tracts open again, and the symptoms are gone. Then we have the loss of function. The loss of sense of smell, loss of sight, and paralysis. We have hyperglycemia and hypoglycemia. These function failures are all controlled by the cerebral cortex. There we have the fear in the neck in the visual cortex. I'm losing vision. That's the biological sense. The loss of function is the sense in the active phase. Otherwise, a function gain is always the sense. In this group, the function failure is the sense. What do children do when they are afraid? They close their eyes. That's more or less the sense here. Or with motor function, paralysis. If the rabbit can't escape anymore, then it's paralyzed. That's the biological sense. What can be sensible about paralysis? The playing dead reflex. If he suddenly appears dead, the predator stops and thinks, what's wrong with him? Surely, he won't have AIDS or something. And then he lets go. If he's not a scavenger, then he lets go. That's how the rabbit can survive the situation. In the crisis he has his epileptic seizure, but then he runs off again. The sense was the playing dead reflex, the paralysis in the active phase, the loss of function. If one looks at it through the history of development, then it all becomes logical. How it developed and what the tasks of the programs are. Also, systematically, germ layer related organs have germ layer related to their brain relays, have germ layer related to their conflicts, behavior, microbe, and crises. So, the whole picture is conclusive in itself. I really don't understand why people don't get that. I don't understand. I try my best. But somehow, so many people can't get out of supervised thinking. Take away their television set, and then they get a crisis, an absolute crisis. Terrible. Ladies and gentlemen, that's it for this seminar tutorial. I hope that the thread of realization gets thicker and thicker and you can hold on to it more and more. Until, finally, you discover that you yourself are the thread. Then you don't need to pull yourself up by anything, then you are truly sovereign. See you in the following seminar tutorial. Helmut Pilhar, father of Olivia,